Brachial plexus. Dissection. After cleaning the branches of axillary artery, proceed to clean the brachial plexus. It is formed by the ventral primary rami of lower 4 cervical, C5 to C8 and the first thoracic T1 nerves. The first and second parts of the axillary artery are related to the cords and third part is related to the branches of the plexus. Study the description of the brachial plexus before proceeding further. The plexus consists of roots, trunks, divisions, cords, and branches. Roots. These are constituted by the anterior primary rami of spinal nerves C5 to C8 and T1 with contributions from anterior primary rami of C4 and T2. The origin of the plexus may shift by one segment either upward or downward, resulting in a prefixed or a postfixed plexus, respectively. In a prefixed plexus, the contribution by C4 is large and that from the T2 is often absent. In a postfixed plexus, the contribution by T1 is large, T2 is always present, C4 is absent, and C5 is reduced in size. The roots joins to form trunks as follows. Roots and trunks. Supraclavicular part. Root C5 and C6 join to form the upper trunk. Root C7 forms the middle trunk. Root C8 and T1 join to form the lower trunk. Divisions of the trunks. Retroclavicular part. Each trunk, 3 in number, divides into ventral and dorsal divisions which ultimately supply the anterior and posterior aspects of the limb. These divisions join to form cords. Cords and branches, infraclavicular part. First, the lateral cord is formed by the union of ventral divisions of the upper and middle trunks, 2 divisions. Second, the medial cord is formed by the ventral division of the lower trunk, 1 division. Third, the posterior cord is formed by union of the dorsal divisions of all the 3 trunks, 3 divisions. Sympathetic innervation. 1. Sympathetic nerves for the upper limb are derived from spinal segments T2 to T6. Most of the vasoconstrictor fibers supplying the arteries emerging from segments T2 and T3. The preganglionic fibers arise from the lateral horn cell and emerge from the spinal cord through the ventral nerve roots. 3. Passing through white rami communicants, they reach the sympathetic chain. 4. They ascend within the chain and end in the middle cervical, inferior cervical, and first thoracic ganglia. 5. Postganglionic fibers from middle cervical ganglion pass through gray rami communicants to reach C5 C6 nerve roots. 6. Postganglionic fibers from inferior cervical ganglion pass through gray rami communicants to reach C7 and C8 nerve roots. 7. Postganglionic fibers from first thoracic sympathetic ganglion pass through gray rami communicants to reach T1 nerve roots. 8. The arteries of skeletal muscles are dilated by sympathetic activity. For the skin, however, these nerves are vasomotor, pseudomotor, and pilomotor. Vasomotor constrict the arterioles of skin. Pseudomotor increases the sweat secretion. Pilomotor contracts the areator pylorus muscle to cause erection of the hair. Branches. The root value of each branch is given in brackets. Branches of the roots. The root value of each branch is given in brackets. 1. Nerve to serratus anterior. Long thoracic nerve. C5 to C7. It only supplies serratus anterior muscle, one of the key muscle for overhead abduction. 2. Nerve to rhomboids. Dorsal scapular nerve C5. This nerve supplies rhomboid minor and rhomboid major muscles, responsible for retraction of the shoulder girdle. 3. Branches to longus colli and scalene muscles C5 to C8 and branch to phrenic nerve C4. The root of phrenic nerve from C5 is small one. The main root is from C4. Phrenic nerve is the sole motor nerve supply of thoracoabdominal diaphragm. In addition, it carries afferent fibers from mediastinal pleura, fibrous pericardium and part of the parietal peritoneum. Branches of the trunks. These arise only from the upper trunk, which gives two branches. 1. Suprascapular C5-C6. This nerve supplies supraspinatus and infraspinatus muscles. Second, nerve to subclavius C5-C6. It supplies the small subclavius muscles. It may give a root for phrenic nerve. Branches of the cords. Branches of lateral cord. 1. Lateral pectoral C5 to C7. This nerve supplies both pectoralis major and pectoralis minor muscle. Second, musculocutaneous C5 to C7. This is the nerve of muscles of front of arm, that is coracobrachialis, both the short and long heads of bicep brachii and the brachialis muscle. 3. Lateral root of median C5 C7. It joins the medial root of median nerve. Median nerve is the chief nerve of muscles of front of forearm and of muscles of thenar eminence. Branches of medial cord. 1. Medial pectoral C8T1. It also supplies both the pectoralis major and pectoralis minor muscles. 2. Medial cutaneous nerve of arm C8T1. It carries sensory impulses from a small area of medial side of arm. 3. Medial cutaneous nerve of forearm C8T1 carries sensory impulses from large area of medial side of the forearm. 4. Ulnar C7C8T1. C7 fibers reach by a communicating branch from lateral root of median nerve. This is the nerve of 1.5 muscles of front of forearm and 15 intrinsic muscles of the palm. 5. Medial root of median C8T1. It joins the lateral root and gets distributed with branches of median nerve. Branches of posterior cord. 1. Upper subscapular C5-C6. This nerve supplies large multipinnate subscapularis muscles. Second, nerve to latissimus dorsi C6-C8 only supply muscles of its name. It also called thoracodorsal nerve. 3. Lower subscapular C5-C6. It helps upper subscapular nerve in supplying of the subscapularis muscles. In addition, it supplies teres major muscles. 4. Axillary circumflex C5-C6. It is responsible for supplying one of the important muscles of the shoulder, the deltoid. It also supplies small teres minor muscle. 5. Radial C5-C8T1. This is the thickest branch of brachial plexus. It supplies all the three heads of the triceps brachii muscle. Then it supplies 12 muscles of the back of forearm. In addition to the branches of brachial plexus, the upper limb is also supplied near the trunk by the supraclavicular branches of the cervical plexus and by the intercostobrachial branch of the second intercostal nerve. Sympathetic nerves are distributed throughout the brachial plexus. The arrangement of the various nerves in the axilla was studied with the relations of axillary artery. Special features: lateral cord, medial cord and their branches form the letter M with the three corners extended. Lateral cord gives musculocutaneous and lateral root of median. Median cord gives ulnar and medial root of median. The lateral root and median root of the median nerve join to form the median nerve. Blood supply of brachial plexus. Vertebral artery and thyrocervical trunk with its branches The suprascapular and transverse cervical arteries supply blood to the brachial plexus. These are the lifeline of this important plexus.